Ducks Unlimited, is that that's the only one we've got, right?
We have the Ducks Unlimited and then the cross-country spectator guidelines
Oh,
from the
okay.
school that we might as well go over real quick as well. Let's start with the Ducks Unlimited plan. Jesse Swenson is here, who helped prepare the document. If we have questions, we can talk to him about it. I think Daryl basically outlined his concerns, which were kind of at the choke points, and then Jesse did respond to that. Did everybody receive the response? I think that if we want to maybe talk about, there's some question about the bar and the line at the bar type, that situation, and we could talk about, that was like the one thing that I think was still left open for discussion. If we want to talk a little about that, I think as far as, the tickets are already bought, so there won't be an issue of people having to buy tickets and do that as they come in, so there won't be that congestion there. Will you have assigned seats?
As we can. We're going to try to, we're hoping to sell a lot of the tables and book the whole table all at once. If we can't, then we're going to try to request people, like see if there's specific people that they want to sit next to, sit with. But the chairs, we've eliminated chairs from each table so that we can separate out as we need to. And there's plenty of room in there for us to add more tables if we need to add more tables, if people want to go sit by themselves at their own separate table. So we're kind of doing a little bit of both, but basically trying to leave it up to the attendees on what they're requesting.
Okay, I think that seems reasonable.
Mm-hmm.
So for the bar and, have you thought about just having maybe a bar tender, or not a tender, but like a waiter or waitress to take orders, or is that too complicated?
We wouldn't be able to have that as the Ducks Unlimited committee. That would have to rely on John Fuchs, and I doubt he's going to have enough people to. I mean, I haven't talked to him specifically, so I don't want to speak for him, but I know he's had a hard time getting bartenders to some of these events, like for like ours at the golf course. So I'm going to guess that probably wouldn't work, so we're trying to find other solutions for it. Typically, the line at the bar isn't terrible anyways because of where we have it set up. I mean, always there is a little bit, and that's where we thought if we kind of try to police it and say, maintain your social distancing, only send like one person from each table up at a time to get drinks for the groups, and that sort of thing, and try to encourage, like I said in the email, like selling buckets of beer, so you're not you're limiting your trips out there.
That's all the questions I have.
Mm-hmm. But I guess if you're really willing to do that, I mean, that's on you guys to make that happen.
On which part? The
bar.
The bar. Yeah.
The police.
The policing part.
Yeah, and we're gonna have whoever's on the MC kind of keep reminding, and then I normally am just kind of floating around because I get bombarded with a lot of other stuff. So that's kind of one of the things I was gonna do is try to keep an eye on that, and if I see bottling up, then go talk to them, try to have them spread out. Let John know, whoever is behind the bar, to kind of keep an eye on it also. If they see an issue, they can let me know or address it themselves, however we want to deal with it. But
You know, we get a lot of these plans, and they're all great plans, but it's all about being able to implement it.
right.
And so I mean, that's where I'm coming from.
Yeah, no, I understand. I feel like we have a pretty good sized committee, and the way we're going to be especially we're going to kind of do this before COVID hit anyways, but since COVID hit, we're having one place to get into a lot of the raffles. Like you buy a card and you get into multiple raffles, so you don't have to go to individual tables. So we should have extra people kind of be able to help monitor and just enforce the rules, because it needs to be done.
I do have I realized one comment, and it says that all persons preparing and/or serving food will be provided gloves and masks to use. I think it shall use,
Yeah. That's
provided and use because we know people will just say, well, it doesn't say we have to use them.
Yeah.
right. And I've been in contact with Gail Watson, and
Yeah.
she is all on board to do anything that needs to be
Yeah.
done. She's
She's-
just really looking forward to being able to
Good.
have it. So
Yeah, and she can reach out to us if she has any questions
Okay.
on that. And I'll probably reach out to her anyway
Okay.
about that, so.
Jesse, what's the date?
November 7th. Oh, we've been on the same weekend for the last
Yeah,
4 years.
4 years.
Does anybody else have any questions?
No, I don't.
Okay, so I'll entertain a motion to approve the Ducks Unlimited banquet COVID-19 plan.
I'll make that motion.
Motion has been made. Is there a second?
Second.
Motion has been made and second to approve the Ducks Unlimited COVID-19 plan. Any further discussion? Take a vote. All in favor? Aye. Opposed, same. Motion carries.
All right, so the next one that we'll talk about is the spectator guidelines. And I have to apologize because Brooke got these to me on the 10th, and I know we just forwarded them to you. I was under the impression that the cross-country meet was in October, so I wanted to have time to kind of go through it, so it was my bad that there was this one coming up this weekend. So I'm sorry that just got to you. One of the things, did you all get the spectator policy from the towns and schools? I emailed it to you, but I do have hard copies if anybody wants to see what those are. What Brooke is proposing
This
does
one right here, I have it. This one.
does reflect,
I've got one.
for the most part,
I got
what the school district has outlined for their spectator policy, other than at the very end, or one of the things that I'd like to see added that is on the school's policy but not on the cross-country spectator guidelines is just a sign-in so that we can do the contact tracing if something happens. So I think if anything, it's maybe even more restrictive than the school policy, because the school policy says all in-district spectators are kind of allowed, so it doesn't necessarily limit how many in-district spectators are allowed. And the cross-country spectator guidelines say limited to family members of the students. There's kind of a list of, it's a little more limiting, we'll say. So, the one thing is you do not have to vote on this policy if you want to take time. We can do it via email. Obviously, the sooner we get it done for Brooke's purposes, the better. But I didn't want to just shove this at you today without having adequate time to review it. So there is, we could still, if you wanted to take the evening and look it over. It is an outdoor event, and I feel there's a lot of comfort level in an outdoor event with people wearing masks as their spectators, and then just there's already limits. There's a lot of the places where I would have been worried have been kind of dealt with, like the starting and the end, the finish. They're going to limit, I guess, not even allow spectators to be at those points. And that's where usually, having been at some of these kind of events, that's where everybody moves to obviously at the beginning and then moves to at the end. So I don't see any reason that an event like this couldn't happen based on these guidelines and the recommendation of having a check-in or a sign-in list of some sort.
And just real quick, something I'm going to do too, and it's kind of for the logistics of where we're having it, and parking purposes, and as well as to cut down the amount of people is I'm gonna move back. We have varsity girls at 10, varsity boys 10:30, JV combined at 11. And then I had it set that junior high would start 11:30, but I'm gonna just move that all the way back to noon, so that way the high school teams that are there can clear out. And then the junior high, some are the same, but I have a pretty large amount of junior high kids coming that are just junior high, so they can come at a different time, and the high school teams that don't have junior high can leave.
Okay.
Okay.
Rick, the only question I had there was with regards to coaching staff being allowed to come, or families of the coaching staff, and with restriction of family members of the visiting team. So with families that have, more than 2 parents, blended families and such, and that, or maybe have 4 or 6 grandparents, they're limited, they won't be able to attend, but the family members of coaching staff can.
I kind of took this a lot from the Manhattan meet, and kind of not trying to recreate the wheel. So I took it from the meets that we've been at and kind of tweaked it to us. I will say that just in general, I don't know really why the coaching staff family, I think that is going to be extremely minimal, if any, just they don't come. But as far as like other people, I don't know, like we can certainly change that. I'm good with whatever.
Well, it's like we said earlier, this is an outdoor event and people are spread out over great distances and such. Probably the people per square foot is less than that in a Walmart parking lot.
Yeah.
And personally, I like to see anybody come to those events. And
Okay.
I don't know if we'd have enough. If everybody showed up, we'd still probably have 10-foot social distancing guidelines met or so.
So do you think it would be? I mean, I guess that's a question. Could I not limit it as much?
Well, I don't know. I just see it as an outdoor event where it's already lots of social distancing. And I'd hate to see a grandparent or a stepdad or something not be able to attend.
Sure. Yeah, well, yeah.
So those kids need all the support they can get. It's much easier to do social distance across country than it is the basketball game.
For sure.
Exactly.
What do you think of Brooke just trying it this way
Okay.
for this event?
Sure.
And then after you get a feel for how it really works, maybe, because isn't the next one the bigger event?
October 10th is the bigger one, yeah.
How does that sound?
That sounds great.
That seems reasonable. That way we get a kind of test run.
Oh, yeah, absolutely. Well, I think the school's been doing a tremendous job of trying to get these things done.
And so sign in, sheet, and then we'll make those times.
Great.
So will you have a different plan for the one in October than you have for this one?
Well, I guess what I'd say is I'll see how this goes this weekend, and then if it seems like everyone's behaved themselves, I might ask for less restrictions on out-of-town people bringing more than just 2 per runner.
Okay.
This stuff changes daily, almost hourly.
Yeah. Yeah, we're kind of chasing our tail for a season as
Yeah.
it is right now.
Yeah. Good, I hope you have a great turnout.
Do we want to wait on this until the next meeting, or we're going to do an email vote on approval of this policy?
It's up to you guys. The first event is this weekend, so if you're comfortable doing it now, I would do it now with the amendments that we talked about.
Okay.
That's my recommendation.
So is there someone make motion for approval of the COVID spectator policy for the cross-country meet? with the said suggestions from Sean to the policy.
I move to that statement.
Is there a second?
I'll second.
Motion's been made and second to approve the policy with guidelines added by Sean. Any further discussion? All in favor?
Aye.
Aye. Opposed, same. Motion carries.
Thank you.
Thanks,
Yeah, thanks, Brooke.
Thank you, Brooke.
Thank you.
So we'll move on to our agenda. The old business, public health officer. What do you got for us, Doc?
Don't have any old business, but I might include the new business in there, which is the influenza vaccinations. Nurse Teresa has ordered our influenza vaccine, and I'm concerned that we might have some difficulty because with her staff, we're gonna have to schedule appointments for the vaccinations. However, it's gonna be interesting with all this COVID protection and stuff, to see what kind of flu season we're gonna have. It might be essentially nothing, but I think we have to advertise the influenza vaccinations.
We at the hospital are doing the same thing. We're not going to have walk-ins to get flu vaccines. We're going to
Yeah.
make them schedule appointments just because of that. So, yeah.
Are you guys doing vaccinations by appointment only?
Yep.
Both of you?
Is that what you'll do too, also, Teresa? Okay.
Yeah, I absolutely hate it because you know, if somebody is just walking by and feels like they want a flu vaccine, I really want to give it to them.
Yeah.
And I hope to be able to do that, you know, to a certain degree. We have a big enough space that we can, you know, we have 2 waiting rooms, so if we have to shuffle people, we can do that. And I'm gonna rearrange one of the offices so that, you know, we can just shuffle people around a little bit. But yeah, that's pretty much what the talk through the whole state is. Almost all the health departments are doing by appointment only, which, you know, is good, but with me being the only nurse there, most of the 99% of the time, it's gonna be tough.
Are you gonna start giving the vaccine as soon as you get it?
Yeah, our all of our flu vaccine is in now.
Oh, good.
Just the remainder of it came in at noon, right before I left, so for lunch. So we have all of our vaccine in now.
Dr. Campbell's comment as far as your limited staff, are you gonna have, what will be the days out to get a vaccine if somebody needs it? Will they be able to get it in a couple days, so to call you?
Yeah,
Or-
we haven't really decided yet, you know, what we're gonna do. The state requires, you know, for some of our grants, we have to have off-site clinics too, and they haven't exactly told us how we're gonna do that. You know, so, and then we also have to have a flu pod. Again, we have to have one of those every year, point of dispensing. And it's just practicing for actually what could be potentially going to happen this year if we do get a vaccine for the coronavirus. It's very likely, just like in Ebola and the rest of them, we'll have a point of dispensing. The feds will ship in all the vaccine, and then, you know, that's pretty much a community-wide thing, though. You know, we ask for help from a lot of the community. And then, of course, the hospital has to have their pod policy done and practiced and that kind of stuff, which I haven't seen that yet. But it's very likely that by after the first of the year, if they do come up with a vaccine, you guys, of course, will have a closed pod at the hospital. and then we're responsible for the 2 nursing homes and, the rest of the community, so. It's gonna be difficult.
Well, you guys do the majority, I think, of the flu vaccines in the county.
We
And-
do,
and,
yeah. Mhm.
You know, if you're, you're gonna have it scheduled every 15 minutes, or how will you do, how many patients can you do a day?
Well, since I've started there, it's went up every year, and we've done, I think last year we did over 600.
I mean, per day, you're scheduling, how many will you schedule per day?
You know, we can schedule them every 15 minutes, you know, but people come in, you know, early, or they come in late, and that's the problem that you run
Things off.
into.
Yeah.
So that's why I'm gonna do some rearranging in the office, so we can kind of shuffle people, so that, you know, the waiting room that most people use in our office is the smallest one. And they're used to it, they always come to that door, which the other waiting room is much, much bigger, so, you know, we just haven't had time to really plan yet what's gonna happen there for sure. So, but we will do our normal advertising, it'll just look a little different than normal, so.
Well, you might get slammed right at the beginning, because the recommendation is to get early flu vaccine, so as soon as the public knows you have it. You know.
Yeah, and the CDC is saying, you know, vaccinate early, and they, you know, their thinking is they just don't want the 2 viruses to collide, so, you know, when people are calling in, we tell them we have it, we're giving it, and I mean, I've given already 3 boxfuls, so
Oh,
at least
okay.
30 doses, and we've only had them for a week,
Okay.
so.
Good.
When do you expect to have some kind of direction on your clinics?
I would expect, probably in the next week, I hope to get, something lined out to get in the paper. I already talked to Bobby about it. She also wanted another article on how the process works, for the coronavirus, because over the holiday, 2 of the people that I discharged didn't get discharged at the state because they were so busy, it was holiday weekend. So it looked like we had 3 cases, and then, you know, in fact, we really didn't, we only had 1. And so when we get close to 4, people kind of freak out, so, but, you know, there's nothing I can do about the state, you know, if they're backlogged, they're
control that.
backlogged. And so, since we don't have a Facebook, yet, Bobby's agreed to put it on her Facebook, and she, messages me every day, even on the weekends, and, then I let her know how many cases we have, and she can put it out there, so that there's not a lot of confusion, because if we get up to 3, then our phone rings off the hook too. I don't know about you guys, but, yeah, if we get up to 3, then our phone rings off the hook, so.
Yeah.
We're at 0 now, right?
We have 1.
No, we're 0
Oh, we're
now.
at 0?
Mhm.
Yeah, it showed
Yeah.
1 today when I left.
Right now.
And the state announced we still have 1.
Yeah,
Yeah. I
there's,
just
like I say,
discharged
it
that
takes
person.
time. Okay.
Okay, so go on to public health nurse. You got anything else for us, or is that pretty much it?
No, really, that's about it, I guess. We're still trying to do our foot clinic and, our home visits. You know, we just wear masks, and hopefully everybody, most of our older folks are pretty much quarantined anyway. They aren't out and about, so, so that's a good thing. But we're still trying to keep as much of our service going as we can. So,
Okay. Okay, we need approval of the minutes for August 19th. Is there a motion to approve the minutes?
I move to approve the minutes.
Second?
I've never seen them.
I know, that's what I was like, I didn't see him either.
I have a copy.
Thank you.
You got one for me to sign, Helen?
Yeah, he's got.
Okay.
Thanks. I know you did send it to me, but I didn't bring it to me.
Yeah, I remember that.
Yeah,
Is there a second to approve then?
second.
Motion's been made and second to approve the minutes of August 19th, 2020. All in favor? Aye. Opposed, same. Motion carries. So next, county sanitary, Silos RV issues, Bingham notice of violation.
All right, I have no updates on the silos RV issues. Probably need to talk about that some more, but right now, we're getting inundated, continue to be inundated with drainfield permit applications and that. The Bingham notice of violation, I was told that the well driller was there and has re-drilled that well. I have
Okay.
not been out to confirm it, but I was told that that well was re-drilled in the appropriate location. So I'll confirm that between now and the next meeting.
So do you have to go see if that other one was sealed off, or is that DEQ's
Yeah.
procedure?
There's actually paperwork that they have to do for that, so that'll be part of it as well, that the
Okay.
abandonment was completed properly.
Okay, so move on to new business. Anything new, Doc?
No,
Just the flu?
Stuff that my
Okay,
major concern was.
okay. Anybody else on the board got anything for new business?
No.
No. Okay, you got anything new for us other than what you went through already, Teresa? Okay, so we'll go to the report for the county sanitarian, Sharon Lewis deviation request.
Okay. So hopefully all of you had a chance to review this, but I'll go through it just real quick. And then we'll let the family talk if they'd like to, but no need to unless I say something wrong. So basically what we have here is an existing drain field that's been serving an old double wide trailer or a trailer on a piece of property prior to our permitting processes. We didn't start permitting drain fields in Broadwater County until the late 90s, 95, 96, in that time period. So any home that was built prior to that or installed prior to that would not have a permitted drain field. And there was no process to make sure that it met the criteria at the time. And so this home was put in approximately 40 years ago, and there's an existing drain field. The applicant would like to now upgrade the home, and in doing so would upgrade that drain field. And so the issue at hand is that in the state of Montana, you have to have 4 feet of separation from the ground surface down to any impervious surface, which would be considered like groundwater, bedrock, a really clayey soil, or limestone, something to that effect. So Montana, 4 feet of natural soil. And what the deviation request is requesting is that instead of us using 4 foot of natural soil, that we will build an elevated sand mound up to create that 4 feet of separation to the groundwater level. And that's a standard procedure that that I have seen throughout the state and actually throughout the country. Different states have different requirements, whether it's 4 feet or 2 feet or 6 feet. It depends on where you are. But an elevated sand mound is considered to be able to create the treatment of the effluent prior to that hitting the groundwater that would be the same, if and probably even a little better than what the soil could do there. So that's what the proposal is in front of you today. So there's the deviation criteria that are outlined in the regulations that we follow for on-site wastewater, and basically I think it's pretty straightforward, because right now there's an existing system that meets no criteria, that we don't know exactly what it is and what's happening. So all of the environmental issues are going to be mitigated. Other than that 4 foot rule, we'll be able to mitigate that through the creation of the sand mound, or the installation of the sand mound. So I think, looking at whether the system is unlikely to cause pollution of state waters, I think it's obvious that this is better than what we had in the past. And I think I meant to print out. I did print out that 75-5605 to bring with me, and of course it's probably sitting in the printer. Typical, but I think that it's pretty, as outlined in the report, that this is going to be better than what we had, and this type of system, an elevated sand mound, is used commonly throughout the country. So,
Hey, Sean, one question I have. Does anything need to happen with the old systems that need to be
no.
removed,
So the
filled
old-
in, or anything
So
like that?
the old tank, if the old tank is not something that we can use, which based on where the house is going and that kind of thing, it just has to be abandoned in place.
Okay.
If it's a concrete tank, they would just, you can have it pumped and then you just crush it with the excavator and then put sand, or you can fill it full of sand if you want to do it that way. There's a couple ways outlined in our regulations on how to abandon that. So I'll oversee that part of it when the time comes as well. But the whatever was put in, like leach lines or rings or whatever,
Right.
it's just we'll just abandon them in place and go from
I
there.
think the
So,
tank is the concern.
yeah. So in the metal tank, you just crush it and potentially pull it out and take it to the landfill, kind of thing.
I believe that's what's there, is a metal.
The steel tank.
Yeah.
So we'll just go through and abandon that, pull it out of there, and take it to the landfill. So properly dispose of it. I'll just indicate that. And the granting of the deviation will not adversely affect public health and safety. Once again, this is I think we're going in the right direction with this. So putting in the new elevated sand mound is going to be a good thing for this. And then it's basically saying, did the applicant somehow create this issue? And that area, as you may know or may not know, is there's just a lot of high groundwater in that area. And systems for a new home would not be allowed based on that standard. We have to go and try to find areas that can meet that 4 foot of separation. But because this is a replacement of an existing system, I felt like it was appropriate to say, yes, let's upgrade the old system. So definitely not something that they created, because they'd probably uncreate it if they could to an extent. So so then in conclusion, I believe that we can approve it with the conditions that, obviously, that they get a permit and that they pay for the permit, that the existing septic tank be abandoned as per what our regulations say, that an elevated sand mound be designed and installed as per our regulations, and that the elevated sand mound meets all applicable setbacks and standards other than this 1 4-foot separation to groundwater. So that's my thoughts on it. And do you guys have anything that you'd like to say?
So,
Do you have any questions of me or the applicant?
No.
Sean, where do they get the permit? I wasn't aware of a permit for Broadwater County. I thought we just needed it for builders, they needed an electrical permit. I didn't know there was a.
So, yeah, since 1995-96, we've had on-site wastewater regulations in this county, and those,
I'm a
if
new
you,
guy, I just.
if you build outside of the county, you have to get a drain field permit prior to.
That comes from your office?
Yeah, yeah. Yeah, and that's what I spend, I would say, a majority of my time
Sure.
doing right now, is on-site wastewater. Especially this year, we're up, I think last year at this time, I had issued maybe 65 permits, and I'm at 107 right now. So with 5 that I could go write next week, I'll write 5 more new permits. So yeah, it's busy. So.
Does anyone else have any other questions? So I'll entertain a
I
motion.
guess I have one question. Who does the engineering? Is that something you help them with, or did you just?
They have, I'm going to help them with it, but also they have a family member that has worked for DEQ that actually used to review my work. And so between Emily, so it's Rob's brother's wife,
correct.
Emily Gillespie. She works for the EPA now, but between the two of us, I feel like we can probably get a good design there. It's not real tricky, thank goodness. I mean, it's just, the biggest thing is finding the right kind of sand. And I've talked to Brandon Bakken, and there is the appropriate grade of sand for doing this. It's kind of a double washed sand, so it's a little, it's not always easy to find, but we do have it locally, so.
Right, great.
And I bought it all up, so it's gonna be really expensive.
That's funny.
So is there a motion to approve the Lewis deviation?
I'll make that motion.
Is there a second?
I'll second that.
A motion's been made and second to approve the Lewis branch deviation septic system. All in favor?
Aye.
Opposed, same. Motion carries.
So the next thing to do will be we'll need to talk about the sand mound design, but also we'll need a permit application, and which includes the new lot layout, how you want to develop it.
Okay.
Some measurements and that type of thing. We can actually use, I mean, we kind of have it based on the drawing that I gave here, but I don't know where the house exactly is going to go. But we can.
Yeah, and I don't think they've both been on fires, and
Right.
yeah, she just got home Monday or whenever, and
Yeah.
so they haven't really got a chance to sit down and plot it out yet, but yeah, we'll definitely.
And then we'll throw it back at Emily.
Yeah,
No,
sounds good.
I have some standard drawings that we can use for that.
Okay.
So.
All right, thank you guys.
Thank you.
Good luck.
Yeah,
Thanks for coming today.
you bet.
Thank you, guys.
Yeah.
Thank you. Are there any other reports? Okay, I do have one thing. Fill out your census paperwork. Cost us $20,000 for each person for 10 years. And no, you don't get the money personally.
Can I say something about that? So today when I was coming back from lunch, they were talking about people, please do your census. It's every 10 years. Right now, as we sit at 12:30, we're only at 58% of Montana's that have filled them out.
Oh
Yeah.
my gosh.
And so they're really pushing for that. So And that was just at 12:30 today, 58%.
They have what, till the end of the month to do that, the
2 weeks
30th?
left, I think,
You got
right?
14 days left, yep.
All right, let's go.
I don't know.
$20,000
Yeah,
is
it's,
what they're saying per person. And at 58%, that's not very good.
No.
Their goal is 80%. We're at like 58% right now. So if you reach the 80%, it amounts to like $19 million. If you were actually get to 100%, it'd be like 20 million or 40 million or something. But the amount of money that you're not going to get, people think, well, I don't report my number. Well, the thing is, it affects everything you do. The thing about the lady says, well, do I get the money personally? No, you don't get the money personally, but it funds your roads,
Oh,
it
that's what
funds
I
your
was saying.
school, it funds your hospital services. All that stuff that goes through the federal government is all funded by the census. If you don't fill out the paperwork, if we don't get it, Butte's gonna, because they're gonna fill out all their stuff.
And they said it was only like a 5-minute.
Yeah, it's really
It's
short.
not very long.
Yeah,
you know,
it's
but
just a
it
few
helps
questions.
the kids' lunches, I mean, the roads,
Yeah.
you know.
I did it online, and I'm not a
Yeah, I
wizard,
did
I'll
mine
tell you.
too.
It took me about 8 minutes to do it.
Yeah, it doesn't take
So
long at all.
Most people get it done in about 3, probably.
We had somebody show up last week at our house, and I had already submitted mine, but she showed up and she had Idaho plates, so they're out.
Good.
doing 'em.
Yep.
Yeah, 58% as of today at noon.
That's
30.
sad.
What's the deadline?
That's bad.
30th?
30th
I
of
think it's the 30th of
September.
September. What
Yep.
I saw.
Okay, so if there's nothing else, then we will adjourn. Yes, Debbie?
New idea. Working with the chamber for the ghost stroll. So Saturday, Halloween, typically the kids go around town. So we need to get on that. The chamber does. What's the process now? Getting it to you, a plan to you, and then you'll email it out?
Yes.
Okay.
Yep.
I will get that to you ASAP.
Just, have we seen anything from the school on homecoming at all? Or is that gonna be,
Not on homecoming, no.
because I think it's next week, not this week, but next week.
I don't know.
So put something in the,
School.
remind me to, and I'll send a email to the principal.
So what, if they're gonna have a parade, what would the guidelines be?
A parade?
Because normally what they do is they have the parade and all the classes come up and line Main Street, so you're already pretty much in your school group when they come.
Yeah, I guess I just have to really think about it. We did some sort of graduation parade. It was a reverse parade, I guess, is what they called it. But,
I think everybody stayed in their car, didn't they, or something, and then the kids.
so, maybe it's something where the floats are stationary and people drive by. I don't, I mean, that's just an option.
Okay.
Seems, it's once again, it's an outdoor event,
Yeah.
so maybe we can come up with some, spread it out, that's the big thing. These kids are already, my guess is,
programmed to wear their masks
and
Yeah.
All that
they're
kind of
already
stuff.
together,
together.
Yeah.
Yeah,
so.
yeah.
But, yeah, I think, have to think about how I don't know how many floats and, is there a marching band that would normally play? I mean, I don't know from a Townsend's perspective how that usually plays out. I went to a big school where the homecoming parade was pretty big, so. So I will email Cheryl, anyway, Cheryl, does that seem right? The principal?
Oh, here.
Eric.
Oh,
yeah.
the principal.
Yeah.
Sheila.
Is it Sheila? Okay, that's, I knew it was something with a so. Yeah, I have, because she sent me the spectator plan as well, so.
Okay.
yeah.
Sherry.
Sherry.
Had to look it up on Facebook.
Yeah, so I'll email her.
Okay, okay. Anything else? Yes?
On August 27th, I submitted a letter requesting that I be considered for the health board. Had that been
That's a different meeting, Tim.
That's a commissioner
That's
issue.
Commissioners.
Okay, if nothing else, then we will adjourn at 1:48.
Great, thank you guys. Sorry.
But you weren't coming.
Well, it's, I had to come for this, so I did have it